Taiwan sports medicine actually has two advantages. One is convenience or accessibility, because in other countries it's not as convenient as Taiwan. If you're in other countries, you may have to be transferred numerous times before you can see a sports doctor. And the second thing is integration. In Taiwan, when you go to a medical center, you can see professional doctors, physical therapists, trainers, nutritional scientists, and psychologists to help you address numerous sports issues. So it's really lucky to be in Taiwan. Hello everyone. Thank you for watching James on Air again. My name is James. Our show will talk to you about the international opportunities of Taiwan's healthcare industry. In previous sessions, we talked about Chinese medicine, ophthalmology, and also cosmetic surgery, and we got really good feedbacks. And today our topic is also very interesting. So people of all ages should care about this topic, and it has to do with our fitness and also sports injury, and that is sports medicine. So during this year's Tokyo Olympics, the Chinese Taipei team won 2 golds, 4 silvers, and 6 bronzes. That's a record-breaking result, and it is truly a good diplomatic way of promoting Taiwan. And with media reports, we're now also paying more attention to the training behind the athletes and also the sports injuries that come along with it. So now maybe people are also wondering, how are the medical teams behind these athletes able to help and treat them? So today we're very honored to have an expert in this area. From Chang Hospital, Dr. Lin. Dr. Lin has been a trainer and also the leader of the medical team for our Olympic team since 2001. So he has helped over 500 athletes in the span of over 20 years and helped these athletes get good results on the field. And in addition to these top athletes, actually everyday people should also pay attention to these topics. So today, Dr. Lin is going to talk to us about sports medicine and also find opportunities in this industry. Thank you, James. I'm very honored to be here. So Dr. Lin, we are very happy to have you as our guest to talk about sports medicine. Personally, I also like to do sports. And I think in the past, there wasn't a specialty in this area. How did it start? Well, actually, to this date in Taiwan, we still don't have a specialty for sports medicine. It's usually doctors who are passionate or interested in this area. For example, doctors who work in rehab and Chinese medicine and also general practitioners. They are the ones who are working behind this field. So how did you start? Well, we have to go back to my college. Back in my college days, I played basketball. So I really like to play sports, so you can see that I'm also more tan. And your height also reveals that you're a basketball player. Yeah, so a lot of my patients also say that I look like an athlete. So yes, I like to play sports myself. And also, I really like to work with athletes and grow with them and train with them. So when I became a doctor, I started looking into sports medicine. So it's usually bone doctors or rehab doctors who are there to help athletes. So bone doctors, they're usually there when athletes suffer severe injury. So I decided that I would opt for rehab or physical therapy rather than bone doctor because I don't want to wait until it's too serious. And then I realized that it's not enough. So I also went to get a doctorate degree at the NTNU in physiological science. Okay, so who needs help in sports medicine? Well, actually everyone, even you. Yes, because average people maybe they think they only need sports medicine if they play sports and get hurt. But actually, not necessarily. You don't have to wait until you get a sports injury. Because now a lot of people are doing sports or exercise. So whether you are kids or senior citizens or adults, we all need to exercise in order to stay fit and healthy. So now there are some people who feel discomfort, like soreness or tiredness or pain after doing sports. So they may not necessarily be classified as sports injuries, but if you just want to feel better after you do sports, you can also come to see us. Well, actually, then I need that as well, because I sometimes do weight training and my muscles get really sore sometimes. So I really need experts. Yeah, a lot of people don't know the difference between soreness and injuries, so they feel panic and nervous after doing sports or exercising, so they can come seek our help. So yes, like you said, sports medicine cover a broad range of different topics. So yes, even though we don't have a specialty dedicated to sports injuries, but we have doctors who work in physical therapy or rehab, and they will also dabble in nutritional science and also even sports psychology. But you also need to have experience working with athletes in order to really provide care. So we are really hoping that in addition to our professional knowledge, we can also accumulate experience working with athletes so that we can have more professional sports medicine doctors. And like my personal experience also, I always felt like there's a lack in my knowledge. So I remember once I was the team doctor for a soccer team, and during halftime, the coach came to me and said, well, what should I feed my players during the 15-minute halftime? And I was stunned because I didn't know what to do. I didn't know what to say. I didn't know what should the athletes eat in between the first half and the second half. So I thought, okay, I need to learn more. And that's why I went to NTNU to continue my studies. So I think sports exercise is becoming more and more popular in Taiwan. So more and more doctors are also looking into this field. Yes, so I think about 10 years ago, I was actually a team leader for our women's tennis team. And Xie Shuwei, Zhang Yongran, Zhuang Jiarong, all these famous female tennis players were on the team, and we were abroad participating in games, in matches. And this experience taught me how important it is to manage sports injuries. So can you talk to us about, maybe share with us a story of how you were able to help athletes return to the court or to the field? Yes, so a lot of people would think that when you talk about sports injuries or rehab, it's just like heat compression or electrotherapy. But actually, when you're taking care of athletes, there are many ways that you can do it. If you want immediate help, then you really need to pinpoint where the issues are. And there are many ways of intervention. You can do it manually, and some people will use acupuncture. But there's a difference between Western and Chinese acupuncture. Chinese doctors, they use acupoints, but Western doctors, they look at fascia. So during the Olympics this year, I remember Li Yang and Wang Qilin, our badminton doubles pair. I was actually there when they played against the Chinese pair during the final match. And I was looking at one of the athletes, Li Yang. He was shaking his hand, so I asked him what's wrong, and he said his hand feels really sore. So I checked and see, okay, it's not an injury, it's just muscles that are really tense, but I didn't have any tools with me. So I just tried to look at his fascia, and I tried to relax his fascia manually. And after that, his muscles were loosened and relaxed, and he was able to play well in the match. And thankfully, they won. They went on to win the gold medal. So this tiny story behind the scenes made me feel proud that I was able to participate and help the athletes get a gold medal. And also, another badminton player Wang Ziwei. It was also during the Olympics. I wasn't there, I was watching on TV, and I saw that his racket hit his head. And it's not the impact itself that gave him a headache, but the shock that injured his neck. So he called an injury timeout, and the doctor that was following or was on site was there. I wasn't there, but this doctor was there, and he just told Wang Ziwei, you have to make the call on yourself. You have to decide whether you can continue to play. But thankfully, he continued and he won the match. But then that night, he came back to the village, and we were trying to help him and see what's wrong with his headache. And I made the diagnosis and decided that, okay, it wasn't the impact, it was the shock that affected his neck. So I helped him with his neck, and that also helped him with his headache. So these two stories really stood out to me. Wow, these two stories are really, really great. And it goes to show us that the reason why our badminton players were able to do so well and even win a gold medal, it was because of Dr. Lin helping them behind them. So Dr. Lin, you have such rich experience. Can you also share with us and share with people, whether they're senior citizens, adults, or even kids who like sports or exercise, can you give them some tips or reminders to help them prevent sports injury? Yes. So you see that there are more and more marathons or road races being organized in Taiwan, and people sign up for that like crazy. But if you look at these people who sign up to these road races, do they really exercise regularly? I have my reservations. And that's why at my practice, I always see these people who come after a weekend of exercise. I think sometimes they want to compensate for a week of non-activity, so they become too active on weekends. And sometimes they are like bandwagoners. They sign up for these races because their friends sign up. So after exercising on weekends, they have to come and see me on Mondays because they overexert or overextend themselves on weekends. So I think to prevent sports injury, the important thing is that you need to do things gradually. So of course, I always encourage my patients to exercise. If you want to exercise, just do it. But say marathon, you don't just run a marathon right away. 42 kilometers, don't do that right away at once. You can start with 1 kilometer, you can start with 2 kilometers. Don't start with 10 or 42 because we all have different physical abilities. It's very important to do things based on your abilities. Start things where you are. And after exercising, if your soreness go away after 2 days, that's normal. But if it stays with you for 1 week or 2 weeks, then that's sports injury. So it's very important that you don't overextend yourselves, and you need to build up your abilities gradually. That's my tips. And also, for young people, teenagers, it's also very important. Sometimes I see some parents taking their kids to my clinic, and you can see these lumps on their knees. So it's actually quite common among teenagers because teenagers, they're still growing, they're still getting taller, so their growth plates are still cartilages. So cartilages would deform if you exercise too much. So for teenagers, it's very important that they don't over-exercise. Yes, do not over-exercise. So if you feel discomfort or injuries to your growth plates or cartilages, you have to be very careful. Do you also run these road races? Yes. Actually, at TAITRA, because we have some special events, we would organize road races in other countries and other cities, 5K or 10K or even different marathons in different countries. So sometimes I would participate in these road races, and I realized that warm-up is also very important. Of course, yes, because if you don't warm up, you will feel more tired. Oh wow, you're so professional. I omitted that. Yes, warm-up is also very important. You reminded me to remind our audience. Yes, warm-ups are very important. So regardless of what sports you're doing or exercise you're doing, it's very important that you warm up, you stretch, wake up your muscles so that they can achieve their peak conditions and avoid injuries. Also, another thing I think for senior citizens, they are more concerned because we have aging population, right? So more and more senior citizens, they have this issue with sarcopenia, or the loss of muscles, and it affects their quality of life. So when we talk about sarcopenia, how do we know? How do we self-diagnose if we have sarcopenia? And can we address that with sports? That's a good question. So now some senior citizens, they can self-diagnose. If you feel like you're walking slower than before, sometimes maybe you're just crossing a street and you see, okay, there's a green light, you start walking, but then you are walking very slowly, and then halfway, the green light is flashing and it's going back to red light. And if you see this kind of things happening to you, actually, as you age, we naturally lose muscles. And after 50 years old, this atrophy or loss will speed up. Your muscles will be replaced by fat and you will lose muscle strength. So you will see things like you walk slower, and also you are less strong and weaker than before. So you can try to self-diagnose. So some people would see within 12 seconds can they sit down and stand up more than 5 times. And you can also use some instruments like testing your grip and testing your body composition to see. So in Taiwan, there are some really good companies, manufacturing companies. They're also coming up with testing kits or testing systems that can help you. And to prevent sarcopenia, well, as the name suggests, it's about the loss of muscles. So the best way is to combine 2 things. First, you need to start with nutrition. So you need to replenish nutrients, especially protein. And the second thing is that you need to train your muscles. So we also promote the idea that senior citizens should train their muscles even when they're at home. Like, yes, doing squats or core muscle training. So these things, they can help prevent sarcopenia, but also osteoporosis. So can you gain back the muscles that you lose? Yes. So it's never too late to train your muscles. It's very important to remember that. So it's reversible. You can definitely reverse this process if you train. Great. So in recent years, sports are getting more popular in Taiwan. A lot of office workers would work out after working hours, and we're also seeing our athletes performing better and better at Olympics thanks to people like Dr. Lin. But then, unfortunately, we have been suffering from COVID-19, the pandemic, so people are stuck indoors. They cannot go outside to exercise. So what can we do to address this issue? And also in the future, can you share with us some trends that you see in sports medicine? So yes, because of the pandemic, especially level 3 alert, people were stuck at home, and if they want to go out, even if they want to go out and exercise, they have to wear a mask. So people were basically turned away from doing sports. So we don't know when the pandemic will be over. So I think the future trends, we may see more and more remote coaching or remote exercise in sports. So I think if you want to continue doing sports, it has to be fun. Sports has to be fun. So some companies like Johnson, they are developing this product, this magic mirror, and also Dai Ziying, the famous female badminton player, would coach people online through this mirror. And with this magic mirror, you can get instant feedback. You can look at your own motions as opposed to your coach's motions, and you can get instructions. So I think these kind of products will be a trend. Regardless of how the pandemic goes in the future, it will be the new normal. A new normal? Yes. And we may not be able to go back to the old normal. So based on your clinical experience, can you also share with us some other products developed by Taiwanese companies. Of course, so clinically, we also see a lot of products, innovations from Taiwan. So I use a lot of PRP. It's a form of treatment to treat sports injury. So PRP, it's short for platelet-rich plasma. So what it does is we draw blood from the patient, and then we use a centrifuge to concentrate the pellet in the plasma, and then we inject it back into the body to help the body self-repair. So Hemosian, a company in Taiwan, develops their own PRP machine, and it's really, really good. And also, there are other companies in Taiwan that are developing things that can help with rehab and physical therapy. So for example, Free Bionics, they have technology that can help patients remotely. And also Wistron also developing exoskeletons to help patients who have maybe suffered from strokes and they cannot walk or climb stairs. So these exoskeletons can help these people, and we have seen the effectiveness. Oh, great! So actually, innovation and products in Taiwan have long enjoyed acclaim and acknowledgement internationally. So if you're interested in these products, please feel free to contact TAITRA, and at the end of our show, we are going to show you a QR code so you can scan it and get more information. Alright, Dr. Lin, I also see that a lot of athletes, especially professional athletes, when they are doing sports, they would have these tapes. Yes, colorful tapes, right? On their bodies. A lot of people would think that it's just a decoration. Can you share with us what exactly does it do? Okay, allow me to explain. So these colorful tapes, it's what we call kinesiology tapes. So these kinesiology tapes, the design, it's designed in such a way that it stretches in accordance to our muscles. So when you put these tapes on your muscles, on your body, it can help relax your fascia and also help with circulation. So it can help the self-repair of your fascia and your muscles. Do you want to try? Oh. Okay, so for example, I play tennis a lot. So I also do mountain climbing on weekends, and I also go to the gym to work out. So for tennis players, what do you suggest? Okay, so for tennis players, sometimes people suffer from what we call a tennis elbow. So these tapes, you can do it two ways. You can tape it in a way that it goes with the muscle, or you can go against the muscle. So it can either relax or support your muscle. So it really depends on what you want to do. If you are doing exercise at the moment, you maybe need more support, but in between your sessions, when you're relaxing, you need to relax. Oh, so in the past, we would also wear like knee pads to protect our knees playing sports. So now we can just use these tapes to do the same thing, right? Well, actually, partially so, yes. You can also use tapes to do the same thing. It can help you support, it can also help you relax. And now in Taiwan, there are also some companies developing these tapes. They are also of really good quality. Okay, so let's try it. All right. Okay, first I need to measure the size. So behind it, you can see these grids that can help you with measurement and cutting. Okay, so you're saying that your elbow is tired from tennis, right? So we can tape it with your muscle. So put it here so that your muscles are extended. And then from the far side, we can start from the near side to the far side. So when you're taping, you don't need to really stretch it because you want it to really stick to your muscle. I see a lot of professional athletes. They would have these like different shapes, different geometric shapes. Yes, they serve different purposes. There's a science behind it, but due to time constraints, maybe I won't be able to make it look so good. Some professional trainers, they would trim the sides so that it looks better. Okay, James, move around a little bit. I feel like I have something supporting my muscle. And it looks cool, right? It looks very professional. I feel like a professional athlete for the first time. I feel like I'm representing Chinese Taipei. And I have a professional doctor helping me. Thank you, Dr. Lin. All right. So again, it's truly an honor that we have Dr. Lin with us today and sharing with us about sports medicine. So of course, sports are vital to our fitness and health. So we hope that all of us can exercise the right way, and hopefully more and more Taiwanese innovations can be seen in the international stage regarding sports and healthcare. If you are interested or have any questions regarding our show today, please feel free to scan the QR code, leave your email, and we will contact you as soon as possible. So thanks to Dr. Lin again for taking the time out of his busy day to come out to our show to share with us. Thank you, Dr. Lin, again. So thank you all for watching again. So we'll see you next time on James on Air. Thank you. See you. Okay, so if you are doing weight training, it's here, right? So from someone's body language, you can see, yes, when you're watching these matches, you can tell from their body language, from their movement, if they are hurt, if they are injured. So when you watch them play, you know if they are hurt, how they got hurt, and how you can help them. And if you play sports yourself, you would know better as well. Wow, thank you, thank you.